Does your baby or toddler squint? Does your child have a hard time reading the board in school or the computer at home? Well, these are signs they need to see an eye doctor. Joining us to help bring awareness to Kids' Eye Health and Safety Month is Dr. Edward Cheeseman, an ophthalmologist at MUSC. It's good to see you again, doctor.
Nice to see you too.
All right, so there's a difference between eye conditions and eye injuries, and I want to talk about both, but let's start with conditions. I always marvel at seeing very young babies wearing eyeglasses. I could never understand how a doctor would know the strength of an eyeglass for a baby or how to even diagnose an eye condition in someone so young. Maybe you can walk us through that a little bit.
Sure. Well, to start with your first question, we use a concept called retinoscopy to go ahead and determine the refraction or whether there's a need for eyeglasses in a child. And to do this, we have to put an eye drop in the eye to dilate the pupil and relax everything. Then we use an instrument called a retinoscope, and that has a certain reflex that we see in the pupil. And then we use lenses to neutralize that reflex. And once we've done that, we have an objective appraisal of their refraction. So that's how we do that with a very young one.
That's so interesting. And the strength in which you need to make the eyeglass, how do you determine that if the child can't even speak yet and explain to you whether he or she can see?
Well, they can't tell us better one or two. So by the strength of the lens that it takes to neutralize the light reflex, and then an optical adjustment, if you will, for the length of your arm will give you the power that you need in the glasses. And some children have fairly significant refractive errors, but thankfully the vast majority do not.
Very interesting. Let's talk about conditions. What are some of the most common eye conditions in children that you see coming walk through your doors?
Well, I think one of the more common ones are infections. And infections generally fall into the realm of a conjunctivitis, which is an infection of the outer layer of the eye. And that has a couple different flavors. It can be either viral, bacterial, or allergic. Other things that we see is a general category called strabismus, and that's a fancy word. It basically means any deviation of the eyes, whether the eyes be turned inward, outward, up, or down. That's a common thing we see as well. Associated with that is another fancy word called amblyopia, which means one eye doesn't see as well as the other for several reasons. One could be if the eyes are out of alignment, and the other could be if there's a difference between that refraction or the power from each eye there, which can lead to this amblyopia condition. So those are some really common ones we see.
I see. Now, for parents, this is Kids' Eye Health and Safety Month. So what are some of the tips that you would give parents to be a little bit more focused on the health of their children's eyes and whether or not they may see signs that they should be bringing them into your office?
Sure. I think one sign is that they're getting right up on top of something to see it. That should be kind of a warning sign. Another sign would be if they squint or if they turn their head to the side when looking at an object of regard, because this could reflect that they're not seeing it as well and they're trying to do something to see it a little bit better. Those are some really common things that are red flags right away. Of course, if there is redness of the eye, a discharge from the eye, crusting, constant tearing, things like this would be an indication for them to bring the child in. With regard to them keeping the eyes safe, one of the things I really like to advocate is the use of sunglasses. They don't have to be expensive. They don't have to be fancy, but they should cover ultraviolet A and ultraviolet B. This gives the child not only protection from the ultraviolet rays of the sun, but a layer of protection from potential injury from objects flying toward them or that sort of thing. So that's a really simple thing that they can do as well.
And as children are going back to school, of course, some of them are going back virtually, but there are still kids that are going to be enrolled in sports and things of that nature. So eye injuries, I would imagine, an eye injury can happen at any point, but especially if you're putting yourself into a situation where you're dealing with balls and you're having to run, or you're interacting with a lot of other kids. What are some of the other ways that children should be protecting their eyes?
Well, that's a good question. One way is with sports type goggles. And I think this is particularly important in small ball type of sports, like baseball is a common means of eye injury, tennis, racket sports in general, ice hockey, things like this, lacrosse. I think it's really a good idea to have eye protection in place for sports like that to protect the eyes, no question. Sunglasses alone are not enough for that sort of thing, but having a sports goggle is important. It's also really important if you're going to be around a pellet gun or a BB gun. Those are some very severe eye injuries that hopefully can be avoided with not only great care and parental supervision, but good eye protection.
The age-old words, don't shoot your eye out.
There you go.
Right?
Absolutely.
Any resources for families struggling during this time that may have lower income, anything that is being offered to them to help keep their children's eyes healthy?
Well, at MUSC, to the best of my knowledge, they accept most all forms of insurance, including all Medicaid type insurances, so that's available. A second thing is that we have some programs within our department, the Storm Eye Institute, where we can, under certain circumstances, help provide eyeglasses for children if they're otherwise unable to get them. Another thing that we've had in the past is called the Storm Site Eye Clinics, where we go out into the community in various locations and provide care to lower income families. Unfortunately, with all the COVID business going on, that's pretty much ground to a halt right now.
Okay. And finally, holistic approaches. Eat your beta carotene. Carrots are a good source and good for your eyes.
Sure. I think just a good balanced diet with antioxidants and, good vitamins, some leafy green vegetables and other things along those sort, you can never go wrong with that, to be sure.
Terrific.
Absolutely. Another thing that I would add too, that I think is important is screen time for children. Even before COVID, kids spend an awful lot of time in front of a computer screen sometimes, or various game devices or cell phones. And we were finding some eye issues with that. And now with some children not having the opportunity to get out and about as much, I think it's even more of an issue. So it's pretty important, I think, to take breaks from that. And from a parental standpoint, limit the time as best you can.
Absolutely. Doctor, thank you so much. Very good advice.
Pleasure to talk to you. Stay safe.
You too. Thank you. We'll be back after this.